Hi, beautiful people. How are ya? It's Dr. Pammy Jean. I hope you're having a great day. We're almost at Christmas, are we not? Are you all ready? I'm getting there. Do you still buy Christmas presents for your family, or do you tend to just get gift cards? That seems to me to be the easiest thing for me, or to order things online. I think as we age, we find it a little more stressful to go out and try to shop for things in a store. I know my children, when they were young, really loved a big Christmas, and that was the only way to shop was to literally go out and do all that shopping. So I definitely feel for some of you who are younger with fibromyalgia and feel that you need to go out and shop. On the other hand, you do have the opportunity that I didn't have back in the day to shop online. Then again, I didn't have fibromyalgia when I was young. I don't know about you, but I do love having things coming right to my door. But today we're talking about iodine and its significance in our lives. It's significant because our bodies don't make it. We have to get it from our food. We'll also look at fibromyalgia and how that is affected. We're going to learn about how much we should be taking and whether or not they'll help us feel better with our symptoms. I did a video on this here a while back, and so if you'd like to learn more about it, you can watch that video. I haven't found a doctor on YouTube who says everybody needs more iodine. I think they're all pretty much going to discuss it the way that I do. So here we go. Many multivitamins and seaweed supplements have iodine in them. Many people get all the iodine they need from their food, but in some cases, your doctor may want you to take a supplement to help ensure that you're getting enough of this important mineral, such as when you're breastfeeding or pregnant. Adults shouldn't take more than 1,100 mcgs per day unless they talk to a doctor first. High levels can inflame your thyroid gland and can cause some of the same symptoms low levels do, including a goiter. A very large dose, like several grams of iodine at once, could put you in a coma. It also might burn your stomach, throat, or mouth and cause a weak pulse, nausea, vomiting, or diarrhea. Even normal levels can cause problems if you already have thyroid issues. Iodine can affect your other medicines too. If you take blood pressure drugs called ACE inhibitors or diuretics, please talk to your doctor before adding an iodine supplement. Iodine supplements can raise potassium in your blood to unsafe levels, and taking them with meds for hyperthyroidism could lower thyroid hormone levels too much. Tell your doctor about all your meds and supplements before you add anything new. But if you're pregnant, you need 50% more iodine than normal amounts. Too little iodine could affect your baby's growth and brain development. It's important to continue eating dairy while pregnant, or you could have low levels. Supplementation of about 150 mcgs of iodine is often required. An early sign that you're low in iodine is swelling in the neck, called a goiter. An inflamed thyroid gland can make it hard to breathe and swallow, and you can feel worse when you lie down. Several things can cause a goiter, so listening to your doctor is important. Iodine is an important mineral found in nature, especially in oceans. Your body needs iodine to function properly, but it can't make it on its own, and instead you need to get enough from your foods or get it through supplementation. Our thyroid is a butterfly-shaped gland in front of your neck. It relies on iodine to make the thyroid hormone that's key for metabolism, your body's process for turning food that you eat into energy. Thyroid hormone consists of two separate hormones, T4 and T3. T4 doesn't directly affect your cells. Your body makes it and turns it into T3, which then affects your body functions such as weight loss or gain, heart rate, body temperature, digestion, muscle control, skin health, and bone health. Not getting enough iodine can lead to hypothyroidism, meaning that your thyroid isn't making enough thyroid hormone. That can cause symptoms such as fatigue, joint pain, and fertility issues, like trouble getting pregnant. Hypothyroidism can cause thinning hair, dry skin, make you feel cold, tired, constipated, and depressed. And you might gain weight more easily. The problem is that symptoms can take years to appear. Iodine is also crucial for babies and young children because it helps their brains and bones develop properly. Iodine's most important role is to ensure proper thyroid function. It helps regulate T3 and T4. So, important sources of iodine are foods such as seaweed, eggs, dairy products like milk, yogurt, and cheese, and seafood like shrimp, tuna, and cod. I love all of those foods. Do you? Some foods may be labeled as iodized foods like our table salt. We should be able to get enough from iodized salt. I probably oversalt my foods, but not enough for it to taste badly or burn my tongue. When you have an autonomic issue like neurocardiogenic syncope, salt is needed. As mentioned in the beginning, getting too much iodine can lead to iodine toxicity, also called iodine poisoning. Symptoms vary depending on how much you take. You could have a metal-like taste in your mouth and an upset stomach, or you could throw up, have diarrhea, run a fever, and have a weak pulse. In severe cases, too much iodine can put you into a coma, meaning that you aren't conscious and can't respond to others. In these studies, 62% of people with Hashimoto's thyroiditis also have fibromyalgia. However, 2 to 7% of people in the general population have fibromyalgia. Hashimoto's is an autoimmune disease. In Hashimoto's, thyroid cells are destroyed via cell and antibody-mediated immune processes. Hashimoto's is not caused by low iodine. But it could be caused by too much iodine. Hashimoto's is very common in fibromyalgia patients at 12 to 34.4%. It's important to have the following antibodies checked to determine if Hashimoto's is an issue. However, hypothyroidism is a condition of low thyroid hormone production, generally caused by inadequate dietary intake of iodine. Up to 15% of patients with hypothyroidism will develop fibromyalgia, a link that has led scientists to investigate the possibility that both diseases have the same underlying cause. But as far as iodine levels, low iodine has been shown to cause low thyroid hormone production. There are a couple of links to fibromyalgia and thyroid hormones, and that's their role in sleep and setting hormone sensitivity. In fibro, neurochemicals are imbalanced, as we know, and the release of thyroid hormone is no exception. And we know how sleep issues are common in fibromyalgia and in people with thyroid hormone problems. But thyroid issues and fibromyalgia have some clinical features that are the same, but they're clearly different conditions. Whatever your type of thyroid disorder, it can make you feel more emotional than you felt before, and you may find that your mood changes, sometimes rapidly and unpredictably. Common emotional problems are anxiety, which is a feeling of nervousness, a racing heart and trembling, or from worries about managing normal daily activities while coping with fatigue and a loss of energy, and depression, which is low mood and difficulty enjoying things, tearfulness, loss of appetite, and lethargy. Also, mood swings, which is irritability, snappiness, or short temperedness. Although thyroid disease can affect mood, it's unusual for those symptoms to be the only evidence of thyroid disease. Thyroid disease, in particular low thyroid, is associated with many other symptoms such as weight gain, more sensitivity to hot or cold temperatures, bowel movement changes like constipation, changes in menstrual cycles, difficulties with concentrating, as in brain fog, short-term memory lapses, lack of interest and mental alertness, feeling tired and sleeping a lot, feeling cold easily, dry or pale skin, or a slow heart rate. So, if you experience any of these symptoms, talk to your doctor. I hope you learned something. I send you gentle hugs and support. Love you. Symptoms vary depending on in severe cases. What? With the structural.